Apocaps, a first-in-class nutraceutical designed specifically to help promote normal apoptosis and life quality in canine patients. Canine cancer is the #1 killer of dogs in the United States seen at veterinary practices, with an estimated 6 million canine cancer cases annually in this country. 1 in 2 dogs over the age of 10 years and 1 in 3 dogs of any age are expected to contract cancer in their lifetime, and it's even more frequent in certain breeds, such as a 75% incidence in golden retrievers. Apoptosis is the new therapeutic frontier in helping maintain life quality in canine cancer. A hallmark of cancer is these patients lack normal apoptosis. What is apoptosis? Apoptosis is a form of genetically programmed cell death. It's a normal, desirable process for clearing old, damaged, or diseased cells from the body. The process of apoptosis is quiet physiologically. There's little inflammation, and the debris from the leftover material is recycled to be used in the development of new, healthy, and vigorous body cells. The photomicrograph in the middle of the screen demonstrates the centralized cell from left to right undergoing characteristic changes associated with apoptosis, including shrinkage, pycnotic nuclei, blebbing, and ultimately fragmentation of the cell into small vesicles called apoptosomes. Those fragments will be cleared by circulating white blood cells and used for future healthy cell production. Apoptosis research is so significant, it was awarded the Nobel Prize in Physiology and Medicine in 2002. Doctors Brenner, Horvitz, and Solston were jointly awarded this prize concerning their work on the genetic regulation on organ development and apoptosis. This excerpt from the publication Apoptosis and the Development and Treatment of Cancer clarifies an important fact concerning its significance. Quote, "One of the few areas in the cell death field that everyone does agree upon is that having cancer cells undergo apoptosis would be a good thing." An apoptogen is a substance that's capable of inducing apoptosis. Dietary apoptogens are those apoptogens that are derived from dietary sources. Apocaps is a first-in-class nutraceutical designed specifically for life quality and longevity by promoting normal apoptosis levels in canine patients. This is the next generation of nutraceutical. One reason is that Apocaps is actually a polyceutical. Unlike most nutraceuticals, Apocaps contains a large array of different constituent nutraceuticals, all of which have overlapping mechanisms to achieve the desired objective of normalizing apoptosis levels in the canine patient. Apocaps is therefore a polyceutical. This is a new class of clinical nutraceutical. Multiple constituents target multiple organs or sites simultaneously. This eases administration and convenience for the veterinarian's client, and additionally achieves a lower inventory because multiple different nutraceuticals are redundant with the single polyceutical formulation contained in Apocaps. This lowers inventory and also additional expense for the veterinarian. The dietary apatogens are found not only in the Apocaps formulation, which is a high-dose apatogen supplement, but additionally in Nutricept. For more information on Nutricept, please click on the video on this website. Examples of dietary apatogens include luteolin from peanut hull, apigenin from parsley, curcumin from turmeric, silymarin from milk thistle, and gingerols from ginger. Apocaps apatogens promote apoptosis at multiple sites in 2 separate pathways. This maximizes the desired effect. Here is a graphic depicting these 2 apoptosis pathways. On the far left is the caspase-dependent pathway, also called the extrinsic pathway, leading to apoptosis in the lower left area of the field. On the right-hand side, we have the caspase-independent pathway. This involves the mitochondria and is also called the intrinsic pathway. In the rectangular boxes are dietary apatogens interacting at multiple different areas within these cascades. These molecular areas are the exact same genetic mutations that are found in cancer cells. As we know, a hallmark of cancer is reduced or absent levels of normal apoptosis. The important thing to take home from this graphic is the dietary apatogens included in these rectangles interact with the precise same molecular targets found in cancer cells in such a way to promote normal apoptosis levels by 2 separate cascades, all acting in tandem. If you look within the boxes, one can depict and make out the dietary apatogens found in the Apocaps formulation, including curcumin, apigenin, luteolin, silymarin, and gingerols. There are other benefits of the Apocaps apatogens in addition to promoting normal apoptosis levels in the canine patient. Coincidentally, they additionally help to normalize COX-2 activity. They also help aid in normalizing angiogenesis. Apocaps utilizes a patent-pending proprietary delivery mechanism called Biovadix. Biovadix works by combining the hydrophobic Apocaps constituents within a micelle type configuration. The hydrophilic sphere that incorporates these apatogens increases the water solubility of the Apocaps particle, which increases the blood levels and the delivery to the desired locations within the body. Since the Apocaps apatogens have low water solubility, and we increase the water solubility through the use of the Biovadix delivery mechanism, we can aid in increasing normal apoptosis levels at relevant sites upon oral administration. Another benefit of Biovadix is it avoids the necessity of dietary fat for absorption of the Apocaps apatogens. Apocaps additionally help support the immune system through the addition of beta-glucans, zinc, magnesium, and glutamine. On top of this, Apocaps helps aid normal function of specific organs of interest in canine patients who are battling apoptosis issues. This includes taurine for cardiac support, glutamine and gingerols to help aid in normal GI function, silymarin, which assists maintain normal liver function, and magnesium, which helps to support normal kidneys. Apocaps is a life-quality pill for apoptosis normalization. For this reason, Apocaps can be used as a standalone palliative for improving life quality in canine patients, but it can also be used as a synergistic approach in conjunction with a comprehensive veterinary plan. Let's look at some case studies. This is Leah. She was afflicted with a biopsy-confirmed hemangiosarcoma that regrew. This is Leah after the use of Apocaps. Excalibur had contracted cutaneous hemangiosarcoma. If you pay attention to the arrows, we can see that those areas are reduced in size, and in some cases, we've got complete regression to the extent of remission in some cutaneous hemangiosarcomas. Sebastian contracted a biopsy-confirmed oral osteosarcoma in the rostral mandibular area. Sebastian was able to live 12 months and die of unrelated causes after the use of Apocaps. The growth was not only curbed, but additionally, the growth shrank. Sebastian was able to avoid the necessity of a mandibulectomy. Ehu had a plasmacytoma, which displayed a correction of apoptosis levels after the use of Apocaps. Washburn is a hedgehog and had a presumptive squamous cell carcinoma. Washburn benefited tremendously from the use of Apocaps as well. At the Animal Specialty Center, an oncology referral institute, various case studies were followed with the use of Apocaps. Their frequency of use in the oncology department was about 80% of patients. They used Apocaps in about 400 cases over a 24-month interval, both during and after chemotherapy. Apocaps was also used following radiation therapy. Zoe was a 5-year-old Labrador Retriever with advanced lymphosarcoma, stage 4A. Zoe relapsed during chemotherapy. With the use of Apocaps, her survival of 8 months was 8 times the median life expectancy for this type of cancer at this stage, having relapsed chemotherapy. Buddy had advanced hemangiosarcoma. He's a 10-year-old male castrated lab. He had stage 3 splenic hemangiosarcoma with liver metastasis. Median survival is only 2 months. Buddy, with the use of Apocaps, had a survival time of 6 months, about 3 times the median survival. Malachi, also afflicted with hemangiosarcoma, a 10-year-old German Shepherd dog, had stage 2 splenic disease. Still alive 6.5 months later with the use of Apocaps, and his survival time was about 3 times the published median survival. The consensus from specialty oncology practice, Apocaps is well tolerated, very high safety margin. There's a low incidence of side effects, worst case scenario being mild diarrhea. Most patients were on concurrent chemotherapy, which in and of itself induces mild diarrhea. The majority of clients continued to use Apocaps long term, and Apocaps was typically started 1 week after the start of chemotherapy. The best results seen with the use of Apocaps are in patients that were afflicted with hemangiosarcoma, squamous cell carcinoma, mast cell tumor, osteosarcoma, fibrosarcoma, and anal sac adenocarcinoma. These animals displayed objective responses that corresponded to normalizing apoptosis levels and promoting those levels. Occasional benefits were seen in patients afflicted with lymphosarcoma, malignant mammary cancer, and malignant melanoma. Dr. Susan Ettinger is spearheading the investigations in Apocaps, and she says, "I have found Apocaps to be a promising new supplement for canine patients." Dr. Ettinger is a member and diplomat of the College of Veterinary Internal Medicine and specializes in veterinary oncology. The National Institutes of Health has recognized Functional Nutriment's work and awarded them a grant for developing cancer chemosensitizer and radiosensitizer using bioavailable dietary apotogens. The question becomes, if some apotogens are good and safe, how much is too much? Dr. Philip Bergman, who developed the canine melanoma vaccine, is spearheading a multi-center study right now involving Apocaps to investigate the maximum tolerated dose. Using those results, differential effects on different cancers, as well as the chemosensitizing and radiosensitizing effects of these apotogens, can be investigated further. For more veterinary portal information, see the Safety, Purity, and Standardization video, the Frequently Asked Questions video. Click on the references link, which will bring you to a downloadable PDF so you can further your study in the publications surrounding Apocaps apotogens. View the Nutricept video, which outlines this exciting new product that also utilizes dietary apotogens. And finally, take a look at the Lumps, Bumps, and Veterinary Practice Challenges video. To order or for more information, contact Functional Nutriments at 1-888-936-4226. You can also visit our website at www.functionalnutriments.com/vet. You can also order directly from your regional distributor.